Imagine this. You're enjoying an ordinary afternoon. Maybe you've just eaten lunch, scrolled through your phone, and now you're lying on the couch. Out of nowhere, a faint discomfort appears in your belly. Not sharp, not alarming, just a dull ache near your belly button. You shrug it off. Maybe it's indigestion, but within hours something changes. The ache sharpens and shifts. Now it's firmly in the lower right side of your abdomen. It's steady, relentless, and each step you take feels like a punch from the inside. Coughing hurts. Laughing hurts. Even breathing deeply feels wrong. At this point, you know something's not right. That's how appendicitis often begins, suddenly, and with a pain that grows in both intensity and precision. Appendicitis is the inflammation of the appendix, a small, finger-shaped pouch attached to the beginning of your large intestine. Most of the time, the appendix quietly exists without you even knowing it's there. For decades, scientists have debated its purpose. Some argue it has no modern function, a leftover from evolution when humans had a different diet. Others believe it plays a small role in immunity, acting as a safe storage space for healthy gut bacteria, ready to repopulate your intestines after infections. Whatever its function, one thing is certain. When the appendix becomes inflamed, it can turn into a ticking time bomb inside your body. So, how does it happen? The most common cause is a blockage at the opening of the appendix. This blockage can come from hardened stool, swollen lymph nodes, after an infection, or even a foreign body, something you accidentally ingested. Once blocked, the mucus and bacteria inside the appendix have nowhere to go. The trapped bacteria multiply rapidly, creating swelling, increasing pressure, and filling the organ with pus. Blood flow to the appendix gets restricted, causing the tissue to die. And if nothing is done, the appendix can burst, spilling bacteria-filled fluid into the abdominal cavity. That's when things escalate to a dangerous condition called peritonitis, which can be fatal if untreated. Recognizing the symptoms is crucial. The classic sign is pain that starts near the belly button and then migrates to the lower right abdomen within several hours. The pain worsens with movement, deep breaths, coughing, or even bumps in the road if you're in a car. Nausea and vomiting often follow. Appetite disappears. Fever may develop, usually low at first, but rising as the infection worsens. Some people may experience constipation while others have diarrhea. But here's the tricky part. Not everyone presents the same way. Children might not be able to describe their pain clearly. Elderly people may feel less pain but get sicker more quickly. Pregnant women might feel the pain higher in the abdomen because the growing uterus pushes the appendix upward. And in rare cases, the appendix sits in an unusual position in the body, leading to pain in unexpected areas like the back or even the upper abdomen. Diagnosing appendicitis isn't always straightforward. Doctors start with a detailed history of symptoms and a physical exam. They often perform a rebound tenderness test, gently pressing on the abdomen and then releasing quickly. If the pain worsens upon release, it can be a sign of peritoneal irritation. They may also check for Rovsing's sign, pressing the left lower abdomen to see if it causes pain on the right. Blood tests help detect elevated white blood cell counts, showing infection. Imaging is often key. Ultrasound is useful, especially in children and pregnant women, while CT scans give a clearer, more detailed look for adults. Once the diagnosis is made, treatment needs to be swift. The gold standard is an appendectomy, surgical removal of the appendix. Today, many are done laparoscopically, using small incisions, a camera, and delicate instruments. This approach typically means less pain after surgery, faster healing, and minimal scarring. However, if the appendix has already ruptured, the surgery becomes more complex. The surgeon must clean the infection from the abdominal cavity, and the patient will need strong antibiotics for days or even weeks afterward. Interestingly, in very early, mild cases, some doctors try a course of antibiotics alone to treat appendicitis without surgery. But there's a catch. This method carries a significant risk that appendicitis will come back later, leading many experts to still recommend removal as the safest long-term solution. Recovery after surgery varies depending on whether the appendix had ruptured. If it was removed early, patients might go home the same day or within 24 hours, walking around by the next morning and returning to normal activities in 1 to 3 weeks. If it had ruptured, hospital stays are longer, and full recovery can take 4 to 6 weeks. During recovery, patients are advised to avoid heavy lifting, eat light meals at first, and watch for any signs of infection like redness, swelling, or fever. So, is there any way to prevent appendicitis? Unfortunately, there's no guaranteed prevention, but evidence suggests that a diet high in fiber, fruits, vegetables, whole grains, may help by preventing constipation and keeping the appendix from becoming blocked. Real-life cases remind us how dangerous this condition can be. There have been instances where people ignored the pain for days, only to end up with a ruptured appendix and life-threatening infection. In contrast, those who sought help early often returned to normal life within a week or two. One famous case was during an Antarctic expedition in 1961 when a Russian doctor named Leonid Rogozov developed appendicitis and had to perform his own appendectomy in the middle of a blizzard, with only a mirror and a few assisting hands. He survived, but it remains one of the most extreme medical stories ever told. Here's the bottom line. Appendicitis is common, but it's not to be taken lightly. The symptoms can start mild, but things can go from bad to life-threatening in a matter of hours. If you or someone you know develops sudden abdominal pain, especially if it moves to the lower right side, don't wait, don't self-diagnose, and definitely don't try to sleep it off. Go to the emergency room. That decision can mean the difference between a quick recovery and a dangerous, drawn-out battle with infection. Your appendix may be small and mysterious, but when it turns against you, it demands immediate action. In medicine, speed saves lives. And in the case of appendicitis, acting fast might just save yours.